Now let's talk about the chronic liver disease, cirrhosis. If you do the language, cirrhosis comes from the Latin word scirrhus. Scirrhus is the Latin word for stone. So in liver cirrhosis, you turn the liver into a useless stone. And to understand the pathophysiology of cirrhosis, we need to review our anatomy and physiology. So the liver is this big organ in your right upper quadrant abdominal area. And the liver, one of the functions of the liver is secretion of bile that goes out of the liver into the hepatic ducts and then in the common bile duct to the intestines. And in bile, what do we have in bile? We have the bile acids, we have cholesterol, and we have bilirubin. The direct bilirubin that comes out of the liver cells is we lose it in stool as stercobilin. And very important to understand the blood supply of the liver. The liver, as any organ in the body, receives oxygenated blood via the hepatic artery. But 2/3 of the blood supply of the liver come through the big portal vein. And this portal vein carries what? Oxygenated or deoxygenated blood. It carries deoxygenated blood. Why does the liver need deoxygenated blood? Well, this is the blood that needs to pass by the liver to be purified. This is the blood that comes to the liver from your GI tract. So the portal vein drains your GI tract, drains your gut, and it carries all the food you eat, the absorbed food to the liver, and the liver is going to metabolize this food and also is going to carry to the liver any oral medications you ingest, and the liver will metabolize these medications. So when we see the anatomy of the portal vein drains your stomach, drains your pancreas, drains your spleen, drains your small intestine, drains your large intestine, drains down till the rectum, and this blood will pass first by the liver before it reaches your inferior vena cava. Very important slide to remember when we come to talk about the portal hypertension, because when you turn the liver into stony, useless structure, now the blood flow in the portal vein is going to be obstructed by the fibrous formation in the liver. So you're going to have backup pressure, you're going to have portal hypertension, and this portal hypertension is going to be reflected backwards on the different organs drained by the portal vein, and we will develop the manifestations of portal hypertension that we're going to review when we get to the liver cirrhosis. Another important thing to consider here is the physiology of the liver. What are the functions of the liver? Well, I always think of the liver as a big factory with two compartments, the detoxifying compartment and the synthesis compartment. In the detoxifying compartment, the liver is concerned with detoxifying a lot of things. One of the most important things is the nitrogenous waste products, the ammonia that comes out of the protein we ingest. Whenever you eat protein, the ammonia is going to be the end result of this protein catabolism. And this ammonia is very harmful to your brain. So the liver is going to detoxify this ammonia into the relatively harmless urea, and your kidney is going to get rid of this urea in urine. And also the liver detoxifies the indirect bilirubin that comes out of the metabolized, destroyed old red blood cells and transforms it to a direct bilirubin. And this direct bilirubin, we can get rid of it in stool or in urine because it's water soluble. This is the detoxifying department, as well as detoxifying the majority of drugs. Most of the drugs, like 99% of drugs, are metabolized in the liver. And when we ingest a drug, it goes to the liver first before it goes to the blood, what we call first hepatic metabolism. Then the synthesis compartment of the liver, or the synthesis department of the liver is concerned with making a lot of stuff. It makes a lot of proteins. One of the important proteins made by the liver is albumin, and albumin gives your plasma its oncotic pressure, and it is the presence of albumin within your blood vessel is what keeps the water inside your blood vessels. If you have low albumin in your blood vessels, water is going to leak outside. You're going to have generalized edema, and in the same time your intravascular volume is going to drop down. Also, the liver synthesizes most of the clotting factors. As a matter of fact, all the clotting factors except factor 8 are made in the liver. So when you have a liver problem, you're not going to be able to synthesize clotting factors, and you are going to have coagulopathy, a bleeding problem. So when we think of the pathophysiology of liver cirrhosis is a state of the liver, pathologic state of the liver. Unfortunately, it's an irreversible, inflammatory, fibrotic liver condition. You turn the liver into useless stone. Useless, so you lose the liver cell function. Stone, so you develop portal hypertension. When you lose the liver cell function, what are you going to lose? You're going to lose the detox function, and you're going to lose the synthesis function. When you lose the detox function, what's going to happen? You're not going to be able to detoxify ammonia. So ammonia will knock down your brain, and you're going to get hepatic encephalopathy. You're not going to be able to detoxify bilirubin, so indirect bilirubin will accumulate in your blood, and you're going to have jaundice. When you lose the synthesis function of the liver, you're not going to be able to make albumin, and your albumin level in the blood will drop. So nothing is going to keep water inside your blood vessels. So water is going to leak outside, and you're going to have generalized edema, or what we call anasarca. And this albumin is going to be deficient, hypoalbuminemia. Very common finding. It's going to tell you that the liver is no longer functioning. And also you will not be able to make clotting factors, and you will have bleeding tendency and elevated INR and elevated prothrombin time. All these because you turn the liver into useless stone. When you turn the liver into a useless stone, you lose the liver function, and now because the liver has become stony hard because of this fibrous tissue forming inside the liver, the portal blood flow is going to be impaired, and the pressure in this portal vein, which used to be very low pressure, 5 millimeter mercury, is now going to be elevated, and back pressure is going to build up. And when due to this portal hypertension, we have high pressure in the veins in the peritoneal cavity. Water is going to ooze outside these veins, and water is going to accumulate in your peritoneal cavity. And this is what ascites, accumulation of water in your peritoneal cavity. This ascites very frequently in liver patients gets infected with bacteria, and we get the condition of spontaneous bacterial peritonitis. And this is a serious infection that needs to be treated with strong antibiotics. Another organ that's going to suffer from this portal hypertension is the spleen. Backup pressure from the obstructed portal flow is going to affect the spleen, and your spleen is going to get bigger. Splenomegaly. What's wrong with the big spleen? When the spleen gets bigger, it also gets aggressive. And when it is aggressive, it's going to destroy a lot of platelets. And when you destroy your platelets are needed in the management of bleeding. So you are going to have more and more bleeding tendency, but now not because of a clotting factor mechanism, but because of a thrombocytopenia, destroyed platelets by the spleen. Varices, esophageal varices. Let me get back to the slide of the anatomy of the portal vein. Now, blood coming from your gut. Your blood coming from your gut wants eventually to make it to the heart, to the right side of the heart. So you're taking the freeway called portal vein. You're taking the portal vein freeway. But now the portal vein this freeway is obstructed because they have some construction on that freeway. They are building a lot of fibrous tissue in the liver. So what do you do when you have obstruction? When you're driving and there is some obstruction in the freeway, what do? You take streets, right? Is there another way? Is there an alternative route to the right side of the heart? Yes, and someone is going to tell you, yes, you can take this route of these small veins that are found in the lower esophagus and upper stomach, upper gastric part of the stomach. They can take you to the right side of the heart. So imagine now all the blood coming from your gut, instead of flowing into the big, huge portal vein, they are going to take the small, tiny veins in the lower esophagus and upper stomach on their way to the right side of the heart. So what's going to happen to these veins? They are going to become dilated and tortuous, and they might even rupture and result in a fatal bleeding, what we call esophageal varices. So the manifestations or the pathophysiology of liver cirrhosis, turning the liver into a useless stone, you lose the liver function, and you develop manifestations of portal hypertension. Finally, what could be the causes of cirrhosis? Any chronic liver disease. And the commonest cause of liver cirrhosis in the United States is alcoholic cirrhosis. Alcohol abuse is the commonest cause. Chronic hepatitis, whether chronic hepatitis B or chronic hepatitis C, another cause of cirrhosis. Autoimmune hepatitis or primary biliary cirrhosis or some metabolic congenital conditions as Wilson's disease, hemochromatosis, and rarely alpha-1 antitrypsin deficiency are among the causes of liver cirrhosis.